Hi, John. Thanks for having me. I'm Neill Marshall. I'm the board chair of HealthSearch Partners, which is a executive search firm that specializes in hospitals and healthcare.
Awesome. Neil, thanks so much for making time to join us on the Avi podcast on this Friday. Before we dive a little bit deeper, as far as your current company, give us a thumbnail version of your career to date.
Sure, sure. So started in the search business back in the early 90s in physician search, and then met some people in executive search and decided that that's what I wanted to do. So moved over into executive search, worked with the largest executive search firm in the country that specializes in healthcare, Whitkeefer, for 10 or 12 years, and then left to start my own firm, Marshall Cole and Associates, which I did for another 10 or 12 years, and then left to start another firm with a former colleague. Did that for about 5 years, and then we merged that firm into HealthSearch Partners about 3 years ago.
Oh, that's super exciting, and thanks for that background. Very diverse, history and things that you have done prior to this. So, talk to us a little bit about your current company. What is the mission, and what are you guys trying to accomplish?
Sure. The reason that we formed HealthSearch Partners was it was three what we call boutique firms in the industry, which are small firms, usually just a couple of people. And we wanted to be able to compete for the biggest searches out there. And in order to do that, we needed to be a little bit bigger. So we took the three firms together, merged them all into one, and because we needed to be big enough to be relevant, but we didn't want to be so big that we had issues with what's called blockage in our industry.
Yeah, that's very. And for how long you've been building this company?
We've been at it about 4 years.
Okay. All right. That's great. That's super exciting. So you've been in this space for quite some time. Talk to us a little bit about the different trends and ideas that in this industry that you're very excited about, something that you've been researching. I guess maybe in your view, what is the next big thing?
Sure. So I think the thing, and this is for a lot of industries, but I think the biggest thing that's happening today is that people can live anywhere. Which means the war for talent is going to get more competitive. Back in the day, if you lived in Utica, New York, and you weren't willing to move, you were stuck working for companies in Utica. Now, if you have the right skills, you can work for any company in the world. On the corollary, I had a client in Utica, New York. I put the chief information officer there, and I called her and I said, "How's it going?" She said, before COVID, I could only access talent in Utica or someone who was willing to move to Utica. But with remote workers today, I can compete for talent across the United States and across the world. And so if I'm good enough, if I create a good enough environment, I can recruit the best people from all over the world. The other part of that is that bad companies, bad leaders, bad cultures aren't going to be able to attract good people. The good are going to get better, the bad are going to wither away. The second thing that I think you asked, what did I find exciting in this marketplace? I think the second one is that bigger is no longer a necessity. At one time, you wanted to work and do business with bigger companies. Bigger was better. You wanted to work with the Amazons, the American Airlines, Big Five accounting firms. They had the resources and the expertise, and they were the industry leaders. Today, I think in a lot of industries, you don't have to be the biggest to be relevant. For example, in our business, the top 3 or 4 companies in our business can't access 50% of the candidates because of this thing we call blockage. It's organizations they can't recruit from because they're clients of theirs. So, for example, if you've got a high profile assignment, you're probably only going to have about 100 potential candidates for that assignment. If your recruiting partner can't access 50 of them, I mean, that's significant. It's going to impact the quality of your search. It's going to impact the quality of the results.
Right.
And I think lastly is a big one today, diversity. Way back when, it was treated like a buzzword. John, when I started 20 years ago, I did a CEO search. I presented 8 candidates to a board. 7 or 8 looked just like me. Today, the mandate is that no longer. We want 3 or 4 of the candidates to be diverse, and not just gender diverse, culturally diverse. Only 50% or 50% are going to be diverse. I've done 2 searches. This is the very first time in my career in the last year where the client said, first group of candidates you present, 100% diverse. Not gender, culturally diverse.
Right.
That's impactful.
Yeah. Wow.
Because both times the person who got the job was out of that first group.
Mm-hmm. That makes sense. No, it's relevant, especially to the current times. And like you've mentioned, it's definitely elevated with the times that we're coming out of. And which brings me to another point that I want to discuss with you with, you've mentioned with some companies that they're succeeding because of their ability to now recruit, globally. Essentially, they're not restricted geographically just to their location. And with companies operating in fully virtual environments, but that also on the other side of the spectrum, that increases the competition as well, 10x, where you
Right.
have companies that are much bigger with much greater packages targeting the same candidates, on a global scale. So what are some of your strategies to help your clients succeed in that space in terms of attracting the top talent?
Here's what I say, John. It's pretty simple. Exceptional people attract exceptional people. You look at leaders' past history when you're looking at bringing them in. Do they bring people with them? Do people follow them? People want to work with great leaders, and they will again and again, and they'll follow them. Nobody works for a bad boss more than once unless they made you rich or you have no other choices.
Absolutely. No, it's, simple, and oftentimes that's overlooked. People looking for more complicated ways to address that particular problem. So, that makes perfect sense. When it comes to, so the war for talent, yes, obviously, that exists. It's a candidate driven market. But when we talk about the next layer, which is that quote unquote war on retention, where companies now, aggressively targeting the top performance at the competitor organizations, what are some of the strategies or recommendations that you provide to your client companies when it comes to building an environment that really fosters that kind of retaining the top talent, so to say?
There's a lot of things you can do. I'll tell you a quick story. So there was a CEO a small hospital in Oklahoma that I used to call. I really liked him. I'd call him every time I had a CEO search that was in kind of his bellwether, right? Where he might be a candidate. Here was a problem, is that his board loved him so much that they signed him to a deal where he was making 3 times more than anybody else that was doing what he was doing. So I would call him, bigger jobs, nicer places, but the conversation always came back to money, and he just couldn't take the pay cut, even though it was a bigger job. So average tenure for a CEO in the hospital industry might be 4 or 5 years. He stayed 15 years. Now, you can't always pay 3x, but you can be better than competitive for the right people. The other thing that I would say is that people typically leave for one of 4 reasons. They don't like the work anymore. It wasn't what they were told in the interview, something having to do with compensation, or they don't like their boss. Fix those things.
Right. No, absolutely. Absolutely. That makes perfect sense. And when we talk about, so you work on both sides. You partner with the hiring organization, hiring managers, and then you represent the candidates as well. So when you collaborate on both ends in terms of preparing both sides for the interview, share with us any of your strategies that really help you succeed in that spectrum in terms of improving your batting average, preparing the hiring managers for that first interview, the same for candidates as you prepare them for that initial meeting. What are some of the things that really help you get both sides going in the right way, set the right expectations?
So on the client side, I learned from an organization that was actually a client of mine. And what I came to discover is these people recruited 100 doctors a year. Okay, that is a huge number of doctors, and these are high. I mean, they're recruiting, people that are making 4, 5, 600 to $1 million a year as physicians, and they had the slickest recruiting process that I've ever seen. The one thing, so I went through that because I went up and interviewed them, right? The one thing that just stuck out at me, I interviewed every top person in the organization, including the CEO. Not a single meeting started late, even with the CEO. They ended on time, and then they took me to the next meeting. That was a culture that they had built, and it was very effective. On the candidate side, I try and provide as much information as possible. So I put together dossiers on all the people that they're going to interview. I resumes, CVs, articles. I look at YouTube videos, add YouTube videos that because most of these people have YouTube videos. So I provide all of that to the candidate and say, hey, you need to look at this, read this, watch their YouTube videos, get to understand who they are even before you've ever met them, so that it's like it's a second meeting or a third meeting when you finally go and see them.
Right, right, absolutely. No, I love these recommendations, and it's there's no right or wrong formula. It's also a combination of, it's an art and a science as well. But setting those expectations up front, I think, is very important, especially when it comes to that very first interview. And then, as you mentioned, the feedback after the interview is also is very critical for both sides to try to get their perspectives on what went well, what went wrong, and things like that, and really apply that for future projects or anything for that matter. So I think that those are unique perspectives. Thank you for sharing that. When as far as in your industry, what have you observed to be? And the reason I'm asking this question is also because our audience on Ivy Podcast is twofold. There's one side is executives themselves who love sharing these practical strategies amongst each other, and the other side is the kind of the early stage career professionals, those that are just entering the workforce, those that are just second year MBAs. And a lot of questions we get from them is around, whether if they're entering the corporate workforce, in terms of the critical skill sets that, you can lay the foundation early, what would be some of your recommendations for those that are just entering, in terms of focusing on something that, will definitely help them succeed down the road?
So I'd say it's a twofold, maybe threefold. Number one, be really good, right? Just be good. Don't be good. The second is find something that in the work that you're doing that you're passionate about, and then become the absolute best in the industry at that. Really learn. Okay. Then the third thing is take all of that, and then what I would call is become a career influencer. Watch the idiot influencers that are doing crazy stuff on TikTok, right? That's not what I'm talking about. I'm talking about being a career influencer. Publish, podcast, speak, network, build that career brand, so that at points where they're evaluating people to get promotions to, they don't say, can they say, we have to have this person, we have to have you because you're the best.
Right. No, absolutely. Those are great and very powerful, straight to the point recommendations. I think, oftentimes they seem so simple, but overlooked. So as you you work with many different companies of different size and organizations coming out of this period of pandemic now structuring their organizations in very different ways. Some are continuing to operate fully remote capacity, some are designing the hybrid models, others are trying to bring the workforce fully on site. What have you observed from your perspective? uh, what's working well, what's not, what are some of your recommendations? Because I'm having a lot of conversations like this within my network with a lot of other executives, and they're always curious what other companies are doing from that perspective.
You know, in my niche right now, I'm not sure that they've figured it out, because you have to remember the my niche is the hospitals, right? And starting March of 2020, hospitals did nothing but focus on COVID until March of 2021, right? They couldn't do anything but focus on how are we going to take care of this massive crush of people that are going to be affecting us. But now that they've got a chance to breathe, they are starting to look into certain things. Back in the day for hospitals, there was no such thing as remote. Okay. Everybody was on campus. Everybody. Now, for a hospital, there are a certain 50% of the workforce has to be on campus, because it's the people, anybody that touches people has to be on campus, right? Anybody that has to touch something on the campus has to be on campus. But there's an awful lot of people that don't. And you know what? They're starting to move off. I talked to the CIO of a hospital in LA. And he said, Neill, he said, you can't believe what this is going to save us, because I'm moving all of my IT off campus. They're all going home. And I no longer have to have this unbelievably expensive office space in LA. We can get rid of one whole building because I'm moving IT and revenue cycle and some things like that off campus. Thousands of people.
And I hear that quite a bit as well. But do you think there will be a need down the road to bring that back to physical locations? What's the kind of more of a longer term thinking there?
I think it depends on the. I think it depends on the position. I think it depends on the position. I mean, there again, in a hospital, there are a lot that have to be hands-on. Period. If you touch people, you do. Although I will tell you, I just talked to a friend of mine. He does um, tele ICU, right? So he ICUs out in certain places where they can't afford to have a hospitalist overnight. His company provides hospitalist services, ICU services overnight. And he said that that's just growing by leaps and bounds, because people are starting to say, you know what? We can do that. You don't have to have a physician standing at your bedside to be able to get the quality of healthcare. Um, um, so I, I do think that there will be a focus long term on how to build relationships and how to get some of the things that you can't do remotely. But I got to tell you, everybody that I talk to says, gosh, my employees are happier and they do more. And there's none of this that, while there are good things that happen around the water cooler, that may be 1%. The other 99% are irrelevant, right? And there's none of that anymore. I had a guy tell me, he said, Neill, he said, I leave my kitchen at 7:59 in the morning, and I'm on a conference call at 8 o'clock. He said, I finished my last conference call at 6. I'm with my family at 6:01. How do you beat that?
Right, right. Absolutely. I love that analogy. And, I'm the same way too. It's right now, zero commute. And I think the work-life balance is definitely has shifted towards, for the better.
Well, and you have literally, if you used to commute an hour each
Mhm.
way a day, you now have 2 hours of your day
Yeah,
that is you added. It's pure, and it's pure. You get to do whatever you want to do. That's a lot of
absolutely.
time.
Yeah, you can't replace that. I think that's pretty amazing. Um, Neil, as far as your sources for learning or your sources for information that you consume on a daily basis, what I call the content diet, share with us those. What do you consume? What do you let your mind be exposed to?
Sure. Well, and I'm not trying to kiss up, but I listen to a lot of podcasts,
Mhm.
John. I have a line, of 100 ready to listen to. What I like, some of the podcasts I like yours. I got interested in Ivy podcasts when you interviewed Dr. Michael Phillips from Intermountain Ventures.
Yeah, you mentioned that.
Which is about innovation in healthcare, right? I recruited his boss, Dr. Mark Harrison at Intermountain, who he's an absolute star. So I'm always interested in what they're doing and how they're redefining healthcare.
Uh-huh.
One of the things that they've done, and I got to be honest, it's like the second door of a minivan. You remember? Well, you probably don't even remember that there was one time when minivans had one door, okay, and Chrysler came out with the second door, and everybody went, that's unbelievable. How could we not know that that was the greatest thing since sliced bread? Well, Intermountain Ventures has done that with, they put together a group of 80 not-for-profit hospital systems to start manufacturing for themselves hard to get generic drugs. Now they no longer have to worry about whether they're being manufactured in India and worry about getting them. They're doing it. It's going to be price competitive, and they're taking control of the whole process, which I believe is going to be very significant and be very successful. The second podcast that I really like, Becker's Healthcare. Becker's, because their guests are typically C-suite hospital executives, which are my candidates and my clients, right? So I listen, and I always listen to the ones if I know the person. When I do, I send them a note, tell them I enjoyed their podcast, and then I'll share it on LinkedIn to try and raise their profile a little bit. The last thing I do, or the other thing that I've really started to love is the audio piece on the Apple News.
Mm.
I've got a curated list of 10 articles that I'm ready to listen to at any point. And whenever I'm in a car or, working out or whatever, I jump on that and listen to an article.
Mhm.
And then the last place that I get my news is I've probably got 500 Google alerts. Okay. These are keywords, topics, and people that are in my niche, which is healthcare executives. So I probably get 10 or so alerts a day. And of those, I might skim 5 or 10 articles that are going to have some sort of relevance to me. And then I'll post 3 to 5 of the articles on LinkedIn, congratulating colleagues on new jobs, promotions, awards, or anything else that, is relevant. And again, help to raise their profile.
Yeah, absolutely. And I appreciate the plug for the Ivy podcast. Now I know for sure that there's two listeners. There's you and my mom. So, that's
Again,
great.
I enjoyed it.
Oh,
Absolutely.
that's great, and I love that feedback. I'll let them know as well that the episode, and that's awesome. But I love the recommendations overall. Just looking at the different sources, because there's just so much information out there, and just being extremely selective. It's so difficult, and basically living in your own little bubble. I think that's what we're all about. So that's very interesting. And for our listeners, we'll make those recommendations available in the episode notes. Um, Neil, last but not least, what are you currently reading as far as a book? And is there a book that you always recommend to others, and why is that?
The book I recommend right now, because I think it's relevant today, and you've probably even heard of it, and because it's kind of centers around what you do. Micro Famous by Matt Johnson. He's also got a podcast by the same name. Are you familiar?
No, not so much, but
Okay.
I'm definitely gonna add it to my list.
Absolutely. So what his deal, the concept is he says you don't need to be famous to be successful. He said you need to be micro famous, dominate a niche by being known and respected in that niche. So like mine is hospital C-suite executive. Sorry, it's have a clear and compelling idea, and then create content that drives home that clear and compelling idea over and over again. Then you build influence around that idea, and that creates demand for your service or product.
That's awesome. I love that. Gonna be another addition to my growing list of recommended books. I absolutely love those. That's why I ask for every guest. And actually, one day I'm gonna come up with some maybe a series of articles where everyone's recommendations. I'm gonna
Yep.
put them on like kind of
That's a
compilation.
great idea. That's a great way to come up with content that'll drive a lot of
Mhm.
a lot of engagement because people will read that.
For sure, for sure, for sure. Neil, I can't thank you enough for your time today. It was very short and very insightful conversation. I personally learned quite a bit. And just like with every guest that I love doing, we'll plan another recording in about a year to see how much have changed and transpired. You and I will revisit the conversation from last year and see how much, we've actually been able to predict. And I'm definitely looking forward to that.
Super duper. Yeah, absolutely.